Hello everyone. So with the COVID vaccine having been out for some time and many people getting vaccinated, I thought I would take a further look into the process of vaccination and tie it into healthcare in general and push the agenda for Medicare for all. So if you aren't aware, what we've been doing with the COVID-19 vaccine has been unambiguously vaccines for all. We have been distributing the vaccine to the population free of charge with no strings attached. No out-of-pocket fees, no deductibles, no co-pays, none of that bullshit. We have been bringing people into a pharmacy, a clinic, a drive-through, whatever the case may be. We've been vaccinating them and we've been letting them walk on their merry way. What I have in front of me is literally cdc.gov. And I want to read to you what this says under the question. So the question, who is paying for the COVID-19 vaccines? It says as follows. The federal government is providing the vaccine free of charge to all people living in the United States, regardless of their immigration or health insurance status. COVID-19 vaccine providers cannot charge you for the vaccine, charge you directly for any administration fees, co-pays, or co-insurance, deny vaccination to anyone who does not have health insurance coverage, is underinsured, or is out of network, charge an office visit or fee or other fee to the recipient if the only service provider is COVID-19 vaccination, require additional services in order for a person to receive a COVID-19 vaccine. However, additional healthcare services can be provided at the same time and billed as appropriate. This is essentially vaccines for all. I mean, that's explicitly what it is. So I would ask you, how is this any different from Medicare for all, from healthcare for all, from free healthcare? We're giving out the vaccines at astronomical rates. I will admit the vaccine output has been really good, even though lately there have been talks about people that are, quite apprehensive to it, but that's an entirely different subject. The vaccine output has been really good. The CDC just released new guidelines that people that are vaccinated can basically ditch the masks. The COVID situation is looking decent right now. And we're giving out free vaccines. You pull up, you get the shot, you leave. How is that any different from if you're outside playing basketball with your buddies, you fall, you twist your ankle, you go to the doctor or the hospital, they tell you you have an ankle sprain. You get treated, let you go on your way, you pay nothing out of pocket. You want to know how that's done? Because it's funded through tax dollars and you don't have to pay anything out of pocket. There's no copay. You don't need a plan. You don't need a health insurance plan. Let me call your provider to see if you're covered for the ankle, because maybe if you're not covered for the ankle, we might have to let you go on that sprained ankle. How is that any different from what we're doing now? And people actually love this. You want to know why I know people love this? Because the polls suggest they do. Allow me to read to you a statistic very quickly. As of March 2021, so this was not that long ago, 68% of Americans are satisfied with the vaccination process. That's almost 70%. An overwhelming majority of the American people are satisfied with the vaccination process. And I would, guess that those that aren't, or at least a certain portion of them, are just against vaccines in general. Okay? So we got 68% of people that are satisfied with the vaccination process. A majority of the American people are in favor of Joe Biden's handling of the pandemic. Well, why is this? Why is this so? Well, I would say it's because it's so damn easy to get the vaccine. I mean, at this point, you can walk into anywhere and get it. You can walk in any pharmacy. I know for a fact at a couple of the grocery stores that surround where I live, you can just walk in, ask for the vaccine, they'll get you the shot, you're on your way. Now, we come back to the question. We return to the question posed earlier in the video. How is this any different from healthcare for all? Something that every other developed country has that America still hasn't picked up on. We pay the most in healthcare. We have among the worst health outcomes. 45,000 to 60,000 people die a year from lack of adequate healthcare. Tens of millions of Americans lack healthcare or are either uninsured. They have plans, they have healthcare plans that they're paying for that doesn't even cover everything. How does that even make sense in a society like this one? A country as rich as this one? It doesn't. We have health insurance companies, we have the big pharmaceutical companies that have essentially bought our government. They're paying our politicians, the Democrats and the Republicans alike, and they're making decisions on their behalf to even more thoroughly pad their pockets with dough by robbing you and cheating you. But what we can do is exercise our power as the majority. There's power in the people, guys, and we really need to get hold of this healthcare situation in this country, because I feel as though if we can change the way we provide healthcare in this country, then pretty much anything is possible. You know, this is one of the biggest issues, in my opinion, that plagues this country. One of the things that makes the rest of the world look at us like we're insane when we overcharge people on healthcare so much. Publicly fund our healthcare in this country, because you're being robbed by the health insurance companies and big pharmaceutical companies. And the thing that people always say, oh, well, our taxes will be raised. Okay, your taxes will be raised a little bit, but you'll net save money because you're not paying $1,000 every month or however much the fuck it is for that shit healthcare plan that you have. And honestly, a conversation can be had to how much taxes even need to be raised, if at all. We can just do a reallocation of funds. Need I remind you, we have a military budget that's tinkering on $1 trillion. Need I remind you that we're shoveling so much money to the police? Our police force has a higher budget than other developed countries' military forces. That's a fact if you didn't know. We don't tax corporations enough. We don't tax the rich enough. So where will the money come from? Oh, there's plenty of places where the money can come from. So with that being said, I had to make this video because I thought it was incredibly important to make. And this is an incredibly important subject to talk about and keep in circulation in the public discourse, because we have to keep the pressure on, because they're not going to change this system unless we make them. Vaccines for all. This is the same way it would go if we had Medicare for all. You have a problem, you have a health emergency, you walk in, they provide service to you based on need, and you walk out not plagued with medical debt. That is the future that I foresee for this country, and I hope it happens soon.